Hello, my name is Jordan Alford. I'm a Pittsburgh State University student. I'm doing a presentation over laser scalpels as an assignment in my influence or societal influence of technology class. I will be discussing different aspects of this technology and kind of why I chose to do this. So let's jump in. So first we're going to go over the materials used to make this piece of technology. Basically, a laser scalpel is kind of like a normal scalpel, only more complicated. It's it's a chamber that has a pair of mirrors, one at each end of the tube, and then a medium in that chamber that produces the light or laser, however you want to phrase that. And then the chamber itself is actually comprised of metals that can withstand the temperature of the laser, because lasers in this case can heat up to 200 degrees Fahrenheit. So it's important that we use metals that do not melt while using this product. And at the very end of the chamber there is a cord, or a wire as some people will say, that connects the actual scalpel to a piece of computer technology that will allow you to manipulate the wavelengths that the lasers are produced at. So this will allow you to penetrate at different levels of tissue per se. So now you're probably wondering, well, how does this laser scalpel work? It's a really long and complicated process, but I will try my best to break it down into simple terms. So, as I had mentioned previously, at one end of the metal chamber of the scalpel is a wire or cord that attaches to computer technology. Well, this computer technology allows the user to adjust the wavelength. The wavelength will determine how much of the laser will be produced, how concentrated, you could say, the light energy will be. After adjusting this wavelength, energy will pass from that computer technology back through that cord and into the chamber with the media, the laser medium. In most cases, this is CO2 gas, as it is a cheaper alternative to other mediums such as argon gas, and I believe people also have considered using ruby-based media. But CO2 is the most common in laser surgeries and just one of the cheapest. When it enters the laser medium, light is produced from the reaction. Photons are produced because basically the atoms in the CO2 gas get excited and produce light as a product. This light will then reflect onto the first mirror, which is at the back end of the chamber, probably closest to where the cord is connected, and will reflect onto the second mirror, which is at the other end of the chamber, where light comes out of. Now, the mirror at the back of the chamber is completely reflective. The other mirror on the other end, however, is also transmittable. So it not only reflects, but it also transmits that energy out of the chamber. The laser is then produced out of the chamber, like I had just said, and it reacts with soft tissue during surgery. And the way that it does this, it reacts with the water in the soft tissue by basically heating it up and causing the tissue to split in half. And a much more simpler way to explain this is laser energy will hit the soft tissue and is then transformed via absorption, which I had just said, into the water content of the soft tissue. Now, because of this, temperatures get elevated, and when tissues are, well, I should say cells. When cells are under large amounts of temperature, they tend to burst, and thus that would create your incision from the laser scalpel. So the next question we will look at is, how much does it cost to produce a technology such as this? Well, the answer to this is definitely a lot. I wasn't able to find specific figures, but one company that I did look at was a company in Australia, and they had quoted their production expenses at $1,185,000 in 2017. In 2016, it was quoted at $1,192,000. Now, that may seem like a very steep price, but we also must understand that we're using very complex resources to produce this technology. These resources aren't cheap by a long shot, and manufacturing this technology is not easy. You have to be very precise in how you make these items, as they are used in surgical procedures, therefore they need to be as accurate as possible. If the wavelengths are off even just slightly, you could potentially injure your patient, and that can be a serious lawsuit. Because production costs are so expensive, we must also understand that purchasing prices for these scalpels can very easily be in the thousands. One company I had looked at went on to say that their scalpels cost an upwards of, I believe, $30,000. Now, that seems like a lot, but when we look at production costs, it kind of balances out in a way, because you are paying for a technology that is advanced, and they've put a lot of money into making this technology. So, since this technology has been introduced, we must now focus on how this has changed our modern day lives. Laser scalpels have made surgeries more precise compared to traditional metal scalpels. Metal scalpels are basically, they're not as accurate. They really aren't, because they allow room for human error. If you do not have a steady hand in surgery, it's easy to miss your mark and make a too wide of an incision, too long of an incision. Sometimes surgeons make too small of incisions. But with laser scalpels, they're more precise. They're more clean cut. There's less loss of blood during surgery, because tissues and blood tend to coagulate and cauterize. So people aren't losing large amounts of blood in most cases. They have potential for less pain and recovery. I'm currently going to school for veterinary medicine, so a few articles I've read, dogs, for example, spaying surgeries, or neutering surgeries for that matter, the patients don't exhibit as much pain afterwards. Usually, it's common behavior for dogs to lick their wounds after surgery has been performed. But studies have shown that dogs are less likely to do so, because these incision sites aren't as painful, they're not as itchy and bothersome, I suppose. And there's also less risk for infection. Because these lasers heat up to such a high temperature, bacteria more or less do not survive this temperature because bacteria found in the human body as well as animal bodies, they aren't extremophiles, meaning that they cannot withstand extreme temperatures such as 200 degrees Fahrenheit. So they pretty much don't survive the impact of the laser. It's just it it's very beneficial because this once again prevents infection. So the laser scalpels have a lot of benefits actually. So by now you may be wondering, how can this product change over time, or how has it changed over time? As I've mentioned several times throughout this presentation, metal scalpels were, and still mostly are, the traditional form of performing surgeries. Because of this, the chances of losing a lot of blood during a major surgery, such as, let's say, heart surgery, can be crucial. It's very important that surgical techs monitor vital signs while a surgeon is performing surgery. Because of this crucial element of surgery, it was proposed, that we find a more accurate way of making incisions while at the same time limiting how much blood loss could occur or how much we could eliminate bacterial infection. This gave rise to the idea of laser scalpels because laser scalpels can cauterize tissues and coagulate blood. Blood loss is very rare in these kinds of surgeries. However, in the future, these lasers can maybe be changed to implement incision sizes. That way, instead of making tiny little precise incisions, maybe you need to do a major incision, like in veterinary medicine. Maybe you need to operate on a horse or a cow, or maybe even a zoo animal such as an elephant. A tiny little laser scalpel isn't going to do very well in operating on these large animals. So maybe we need to look at potentially making an alternative to our current laser scalpels. Maybe we need to make them come in ranging sizes or ranging wavelengths, depending on whatever tissue you're needing to penetrate. Which brings me to my next point. As I've said, laser scalpels are mostly involved with soft tissues. This means like skin tissue, organ tissue, tissues that usually have water stored in them. We could also look into doing hard tissues such as bone or teeth enamel. Dentists could potentially benefit from an advancement in this area. Maybe dental surgeries wouldn't be criticized so harshly, because I know a lot of the general public is afraid of going to the dentist for dental surgery. Maybe this would ease the fear of doing so. So it would be beneficial to expand the areas of this technology and look into other avenues of how we can apply this technology. When talking about advancements for this technology, we should also consider some disadvantages. Current disadvantages that I personally know of, just from different classes I've actually taken at Pittsburg State University, would include potential radiation from frequent exposure to these laser scalpels. lasers, since it's a light energy, they emit radiation. Almost all light energy does. I don't think there is a light energy that does not emit radiation of some kind. So because of this, if you're someone who has to have multiple surgeries for some health issue that you have, then increased exposure to these lasers could put you at risk for radiation, which then in turn would alter your genetics and possibly your tissues and other bodily functions. Another disadvantage would be that most health insurances do not cover this kind of surgery. This is because laser surgery is not as common as you would think it would be, since it's an advancement in the surgical field. But also, it is very expensive, and health insurances, from my knowledge, don't particularly like covering expensive procedures. I mean, they would rather take the easier route and go with a traditional surgical setting than a fancy laser scalpel setting. Laser surgery is also still being studied and developed. Because there's not many surgeons who use this type of technology, there's still a wide array of things we do not know about it. And this could actually be a downfall, because if we don't know about, maybe it has other potential health risks that we don't know about. If we don't know about these, we can't warn our patients or patrons about this, and therefore we're at a disadvantage. We don't have the knowledge, we don't have the experience. It's a very iffy field since it's not very developed yet. And another disadvantage could be that healthy tissue can be severely damaged if this technology is misused. So surgeons that may not have a steady hand that use this technology, they may make an incision in the wrong place and therefore sever an artery that's crucial, or they may introduce skin problems in the future, because based on genetics, some people are more sensitive to skin cancers or tissue cancers, and that's just on their genetics. If they are introduced into this procedure, then they could potentially develop cancer or other serious risk from it if a practitioner is not paying attention to what they're doing and they are not screening their patients appropriately. So I'm going to quickly run over improvements. Based on the last slide that I just talked about, the first 2 points should be pretty self-explanatory. Lasers could easily be altered to where radiation exposure is decreased to prevent other health issues. Surgeons and professionals that plan on using laser scalpels should be appropriately trained by the company that they purchase the lasers from. That way there's no inappropriate use of them. Lasers, like I've also mentioned, could be altered to where they could be used for different tissue types and not just limited to soft tissues. Also, I feel that the cost of product could be reduced potentially if we can find other alternative and cheaper resources to do so. And those are just my personal feelings on what could be improved for this technology in the future. Guys, that's all I have for you, so I hope you appreciated my presentation and are more thoughtful in medical innovations for the